Intravenous access. Intravenous, IV, access is a medical procedure that involves inserting a thin, sterile tube, catheter, directly into a patient's vein to provide access to the bloodstream. IV access is essential in healthcare for various purposes, including delivering medications, fluids, blood products, and nutrition, as well as for drawing blood for diagnostic tests. Here are the key aspects of intravenous access. Indications for intravenous access. Medication administration. Many medications, including antibiotics, pain relievers, and chemotherapy drugs, are administered intravenously for rapid and precise delivery. Fluid replacement. IV fluids are used to restore or maintain hydration, correct electrolyte imbalances, and provide nutrition to patients who cannot eat or drink. Blood transfusion. Blood products, such as red blood cells, platelets, and plasma, are administered through IV access in cases of anemia, bleeding disorders, or surgical procedures. Diagnostic blood tests. Blood samples can be drawn directly from an IV line for laboratory tests. Monitoring. IV access can be used to monitor central venous pressure, CVP, and administer medications or treatments that require a central line. Emergency situations. In emergencies, rapid IV access can be crucial for delivering life-saving medications or fluids. Palliative care. IV access can be used in hospice and palliative care settings to manage symptoms and provide comfort to patients. Procedure for inserting an IV. The steps for inserting an IV catheter include: 1. Selecting an appropriate vein based on patient characteristics and the purpose of the IV. 2. Cleaning the insertion site with an antiseptic solution. 3. Using a sterile catheter and needle to puncture the vein. 4. Advancing the catheter into the vein while withdrawing the needle. 5. Securing the catheter in place with tape or a dressing. 6. Connecting the IV tubing to the catheter and starting the flow of fluids or medications. 7. Monitoring the IV site for any signs of complications, such as infiltration or infection. Types of IV access. There are several types of IV access, including: 1. Peripheral intravenous (PIV) line. A short catheter is inserted into a peripheral vein, typically in the arm or hand. 2. Central venous catheter (CVC). A catheter is placed into a larger, central vein, such as the subclavian, jugular, or femoral vein. Types of CVCs include: central venous catheter (CVC), placed in a large vein near the heart, used for long-term access. Peripherally inserted central catheter (PICC), inserted in a peripheral vein but advanced to a central location, suitable for longer-term use. Implanted port, surgically placed under the skin with a catheter connected to a large vein, ideal for long-term access. 3. Arterial line. A catheter is inserted into an artery to monitor blood pressure continuously or draw blood samples. 4. Midline catheter, placed in a vein between a PIV and a central line, suitable for intermediate-term use. 5. Hickman and Broviac catheters. Hickman and Broviac catheters are types of central venous catheters, CVCs, used for long-term intravenous access. These catheters are inserted into large veins near the heart and are typically used for patients who require frequent or prolonged intravenous therapy, such as chemotherapy, long-term antibiotics, or total parenteral nutrition, TPN. Both Hickman and Broviac catheters are designed to provide stable and reliable access to the bloodstream. Here's an overview of each. Hickman catheter. A Hickman catheter is a type of CVC that was developed by Dr. Robert O. Hickman. It is a tunneled catheter, which means that it is inserted through a small incision in the chest and then tunneled under the skin before entering a large vein near the heart. The catheter has multiple lumens, tubes, that allow for various purposes, such as administering medications, fluids, or blood products. Key features of a Hickman catheter include: 1. It can be used for an extended period, often for several months or even years, depending on the patient's needs. 2. The external portion of the catheter exits the body through a small exit site on the chest, making it less visible and reducing the risk of infection. 3. Hickman catheters require routine care and maintenance, including regular flushing to prevent clot formation. Broviac catheter. A Broviac catheter is similar to a Hickman catheter in terms of its design and function. It is also a tunneled catheter inserted through the chest and into a large vein near the heart. Broviac catheters are typically used in pediatric patients, including infants and young children, who require long-term intravenous access. Key features of a Broviac catheter include: 1. It is designed with a smaller diameter to accommodate the needs of pediatric patients. 2. Like the Hickman catheter, it can have multiple lumens for various purposes. 3. Broviac catheters are used for an extended duration, and their care and maintenance are similar to those of Hickman catheters. 6. Transthoracic catheter. Transthoracic is a medical term that refers to an approach or procedure that involves passing through or across the chest wall. The chest wall is the anatomical structure that forms the outer boundary of the chest or thoracic cavity. Several medical procedures and imaging techniques use the transthoracic approach for various diagnostic or therapeutic purposes. Here are a few examples. Transthoracic echocardiography, TTE. This is a non-invasive ultrasound imaging technique used to assess the structure and function of the heart. During a TTE, a transducer, ultrasound probe, is placed on the chest wall to obtain images of the heart's chambers, valves, and blood flow. Transthoracic biopsy. In some cases, a tissue sample may need to be taken from structures within the chest, such as the lungs or mediastinum, the space between the lungs. A transthoracic biopsy involves inserting a needle or other specialized instruments through the chest wall to obtain a tissue sample for diagnostic purposes. Transthoracic surgery. Surgical procedures that involve accessing structures within the chest cavity are performed using a transthoracic approach. Common examples include lung surgery, thoracotomy, heart surgery, and procedures to remove tumors or masses in the chest. Transthoracic cardiac defibrillation. In emergency situations where a patient experiences life-threatening cardiac arrhythmias like ventricular fibrillation, defibrillation pads or paddles are placed on the chest wall for delivering an electrical shock to restore normal heart rhythm. Transthoracic needle aspiration. This procedure may be used to drain fluid or pus that has collected in the chest, pleural effusion, or around the heart, pericardial effusion. A needle is inserted through the chest wall to aspirate the fluid for diagnostic or therapeutic purposes. Thanks for watching.